Of NASCAR driver Kyle Busch from sepsis is now renewing calls for Congress to pass bipartisan legislation supporters say could save thousands of lives every single year.
WCNC Charlotte's Ben Briscoe explains the push behind the legislation and shares the story of a family forever changed by sepsis.
Busch died in May, one of an estimated 350,000 Americans killed by sepsis every year. That's when the body's response to an infection spirals out of control and begins attacking its own organs. Sepsis kills more Americans than AIDS, opioid overdoses, and breast cancer combined. Yet legislation aimed at reducing those deaths has been stalled in Congress for nearly a year. Now families who lost loved ones are urging lawmakers to act.
People have to say enough already. 350,000 Americans a year are dying from sepsis.
For the Stantons, that statistic is personal. Their son Rory was just 12 years old when he got a cut from gym class which became infected, sending him into septic shock. Within days, Rory was gone.
He loved life. He had huge dreams, absolutely huge dreams. And he was a really good kid.
The Stantons say the hospital Rory went to did not have a formal sepsis protocol in place. As a result, they say treatment did not start quickly enough.
We know that antibiotics and fluids can save your life if you get there fast enough.
According to the CDC, about 3 out of every 4 hospitals report having a sepsis program. Supporters of the Sepsis Act say that's not enough. The bipartisan bill would invest up to $100 million over 5 years. The goal is simple: help hospitals recognize sepsis sooner and start treatment faster.
It will task the CDC with expanding education on the condition, establish national information sharing on the best practices, and improve data collection.
If you go into a hospital and you're suffering from a heart attack, from a stroke, they will respond immediately. We want to know that every hospital can respond in the same way to sepsis.
The bill has support from Republicans and Democrats, major hospital groups, and health systems, including Novant Health, who wrote right after the bill was first introduced. The Sepsis Act takes a comprehensive approach that reflects sound policy principles, and the legislation builds on proven success.